excited. I'm happy to be here. My name is Dr. Tova Goldfein. This is TMS Roundtable Global. We are all around the world today. It's 12 o'clock in Israel, and I'm here with my delightful, wonderful colleague and host of this show who helped me create this, Rose Hoy, from down there in Australia, where the kangaroos have their little babies in their pocket. Hi, Rose.
Hi, Tova. That's lovely. Yeah, just down by the river, actually. Now, today, it's 7 o'clock at night here in Melbourne. We've got Dr. Eshay Friedman. Now, Dr. Friedman is actually an emergency room doctor. His background is emergency room. Think about it, ladies and gentlemen. He's seeing chronic pain patients all the time, year in and year out. But he didn't have enough, what would you call it?
Tools.
Equipment in his toolbox, so to speak, about how he was going to alleviate these people of their chronic pain. So, of course, in his research, he found that there was a whole branch of medicine that wasn't being in the mainstream. And he has now spent his time becoming a mind-body type doctor. He's in private practice and he's also in the emergency room. Can you imagine what it's like when someone goes into the emergency room now where he works and they've got a constant headache? He won't be asking them about scans first. He'll be asking them what else is going on in their lives. What else is happening to you? And that opens the door for the patient to see that their pain is a constant pain. Thank you, Dr. Friedman, for joining us. And please just tell us how you, because I know Dr. Alan Abbas used to be an ED doctor. We've got another, Dr. Diamond, I can't think of his first name now. He was an ED doctor. He's now an ISTDP psychiatrist, as is Dr. Alan Abbas. And there's quite a few, most of them are actually less ED and more psych. Mm-hmm. But at the same time, it's the ED doctors that are making that transition over to a somatic pain situation. Yeah, there's quite a few in England already. Yeah. So please tell us, or the audience as well, a little bit about yourself and what made you change your mind about just doing straight medicine without, or actually seeing straight medicine as one discipline and psychiatry is another discipline, because you've actually amalgamated them both, haven't you? Mm. So that we've got a mind-body perspective and a physical perspective. So please share with us.
First of all, it's really, really a delightful opportunity to be here with you both. And thank you for the option. And I hope my English will be fluent enough to get what I want to say through. I came into medicine with an holistic approach. I studied Chinese medicine beforehand, acupuncture and tuina and herbs. I didn't really practice then because I really wanted to endeavor deeply more inside the physiology of the human being. But my view was always the holistic type, and after years in the ED, in the emergency departments, I didn't lose touch with that inner calling. I did a bit, but then the inner calling, it was still
got louder.
It was there in the background.
It got louder, and I couldn't shut it down more. And the way that I perceived patients coming into the ED, it's funny. I was talking to my wife a few weeks back, and I had this brilliant idea that in the future, EDs, there's a triage nurse at the beginning. You come into the ED, and there's a nurse, greeting you and saying, why did you come? If it's an emergency, and they do a little triage to see if you need to see a doctor right away, or it can wait for a few minutes or a few hours sometimes. So I had this epiphany that in the future, emergency departments, near the triage nurse, there's going to be, a therapist. sitting there and just, and dividing
It's
the
happening. It's
mind-body
happening.
syndromes, from the organic, physiological syndromes. And all of a sudden, I saw this great picture of a therapist or a doctor or a mind-body practitioner,
Or a nurse. Yeah.
right? Just looking at this woman with fibromyalgia that is gone, to everywhere, and not getting exactly what she needs, not getting the tools that she needs, or the migraine patient that's coming in for the 5th time this month, or the IBS young girl coming in and spending hours and hours in the ED, and instead of bringing them in through the normal channels of normal physiological doctors, having also them being very, very much frustrated that they, what am I going to do with her again? That's the talk. It's like, oh, this the migraine. I really want to help, but what can I do? And the tools, as you said, Rose,
Well,
are
this is actually happening in Australia at the moment. And of course, Dr. Alan Abbas's hospital in Halifax, that's exactly what they do. So it's already
they have a
happening.
triage for mind-body syndromes.
Yes, yes.
Wow. Okay.
So if you've got influence,
Maybe
Dr. Alan
that's why
Abbas is
you're there in
amazing.
that hospital.
Yeah. Some psychologists and psychiatrists, I think, are actually trying to sort that out in a Queensland hospital at the moment, so that the triage nurse will actually start the process, and then it will go on to the residents, and then they'll be able to work out what tests they need to do. Yeah, and that's a simple question. What else is going on for you? Is there any other problems? On our TMS Roundtable page, we've also got a nurse who works in recovery room, and she's an ISTDP psychotherapist, and she uses that in recovery room. When they've got massive pain, she asks them what else is going on. And as soon as they start telling her what else is going on, the pain drops. So keep up the good works, because we need you people, because you're the pivot.
Right.
So keep it going. Anyway, enough about me.
You haven't told me anything about you, actually.
Yes, I have my story about chronic pain.
Yeah.
Yes.
Yeah.
So, just tell us about that whole awful feeling of someone coming in with IBS and they've had another episode and nobody ever asks them. They go to the tests and they go, getting a clinical assessment about their symptoms, but there's no question ever asked.
And I have to say that, being an emergency physician, it's very, very difficult to take the time and shut yourself from everything that's going on the floor. It's very, very busy. All the people around you, everybody wants your attention, and taking a few minutes just to,
it's in and out, isn't it?
It's in and out, and so I have to say that, in regards of emergency physician, it has to be there's something more of a structural problem than it is, humanistic problem. I mean, the doctors there, they really want to they want to help. They want the tools to help. If they had the tools, they would use them. I think the talk and the perspective about body-mind syndromes is still not mainstream.
No, unfortunately.
It's ridiculed sometimes, but it is getting there. I mean, there's an underlining talk among the doctors that already see, if we're talking about fibromyalgia as one main body-mind syndrome, there's already a talk that understands that this is much more than a rheumatological issue. Also, in conferences regarding fibromyalgia, it's very, very mainstream talking about mind-body syndrome regarding fibromyalgia. And so I think that slowly people are getting to understand that the disconnection that we were taught in med school regarding body and mind is really is really nonsense. And people are
Look, one of the things that I've discovered over the years is that the doctors know the connection, but they don't know how to actually link it for the patient. And that's where people like you are setting a precedent. And Karen says in recovery room, for example, the other nurses will come to her and say, I've got a patient whose pain I can't settle. Do you want to come and talk to that patient? So they know that there's people in the system that understand how to speak to those patients. And that's where you come in, because as you speak to a patient, even if you're just doing an assessment on them, you're able to sort of gather what else is going on and steer them in the right direction. And then the others will notice.
right.
So,
Even
yeah,
even seeding their idea or ideation about this patient, even saying a little bit,
exactly.
then that
Yeah,
opens the door to more opportunities and more information yet to come.
curiosity,
That
curiosity.
relationship between the doctor and the patient is more important than I would ever have believed. And can you imagine in an emergency room, you know, to have that compassion coming from you to them, and them feeling and them calming down right away. That's already neuroplasticity happening right away, that they're feeling safe. You're speaking with them, not at them. You're, like, not like on the TVs when we see, Grey's Anatomy and stuff, but real. You've got that natural compassion that you're already giving your patients.
I hope it was that simple.
It's not really though, is it?
It's not.
It's not.
Yeah,
No, no,
I
it's too
wish.
busy.
It is. It's a lot. It's a lot, and I recognize. We're working with my residents. I sometimes talk to them about just listening, just listen to what's not being said. Just listen to the patient, and that already switches something in the mind of a doctor coming into a patient's room and knowing the prognosis and knowing the diagnosis and knowing what to do and knowing, just shut up, let me do my job. And, just listen and listen for a minute. And if you listen, you'll understand exactly why the patient came and what does he need from you. And most often it's not, another injection of whatnot. It's something else completely. Sometimes it's not, but there's a lot of time that just the moment
Y-
of you noticing what's between the words and in
Yes.
that inter relationship between the sick patient and his spouse, his wife, or whatever is going on there. It says so much, right? But as we said, it's an opening, it's a doorway to things that come. Also regarding patients and residents and attendings, but also regarding the patient itself. Just talking with the patient and opening up their mind to listen. Maybe this could be something else. Maybe this could be something
Yeah.
that nobody ever talked to you about.
Yeah.
Go and research that, and I that's what I do. I don't practice ISTDP yet.
Mhm.
I don't have any real fast um,
Mm.
something that I
Yeah.
can
But you,
Google.
but you've tuned into the PRT. That's my next
Yeah.
question.
Yeah.
Tell us about that, because that must be on the right track.
Right.
Yeah.
So PRT. I think is it
You
came
can
to
give
me.
a quick for any of the listeners that don't know what it is, if you can just give a quick explanation of pain reprocessing therapy.
So pain reprocessing therapy actually utilizes it. I think Sarno talked about it at the beginning, in the 70s, 80s, not about the PRT, but about repressed, feelings. And then Dr. Schubiner, had this. It's kind of an evolution of Dr. Sarno's work,
Yeah.
and the pain reprocessing therapy actually takes the pain and starts with some neuro education, a lot of like what Sarno did with his patients, but just extra new technology, fMRI, science-based knowledge, to get that information to the patient, changing his perspective about pain, and then using tools like positive affirmations and somatic tracking, and all these kinds of tools to just disconnect the fear factor from the pain. And once doing that, which is also scientifically proven, when the pain is involved with so much fear, then the pain just it's pushed up exponentially. So once we take that fear off and disconnect the fear from the pain, what's left is just a feeling or a thought, and then working with that towards just rewiring the brain's circuitry.
Can we say that when somebody can speak to themselves when they're in pain, if somebody can somehow have some kind of self-compassion and acceptance and understand the fear is, and understand the ability that, could we say that they can create their, rather than placebo, that they can create their own Valium, or they can create their own calming medicine because the chemical reaction from the relationship changing while they're in pain? Like,
there were studies done with affirmations being used in a strength posture. I don't know the exact English term. Standing, broad shoulders, holding your fingers up, and really there was it's not non-conclusive, but there were studies made to see if those affirmations that are done in such a way, meaning the affirmations first of all have to be acknowledged by the patient itself to be true. That's why the neuroeducation is so important. And once they know that their back pain is not from their back, and they know that they're safe because they studied it and they saw the literature, and they know that it's not from the back. And then when they're in tremendous pain and they can't get out of bed, and they have this strong posture even lying down, and they say, I know I'm safe. I know I'm safe. I know this is just a phase. I know my back is healthy. So a lot of times, if they say it enough, the pain just tones down. It really is miraculous. And sometimes, we really, Dr. Schubiner says this all the time, we underestimate the power of the mind. We underestimate it. And it's one of my diagnoses, or that I learned from Dr. Schubiner. Diagnosis methods is using this affirmation and then testing the pain. If my face is painful when I touch it, and I'm in excruciating pain, and then I do these affirmations with the psychoeducation, with the knowledge I already accumulated, and I say, I'm safe, and there's nothing wrong with my face, and I know it to be true, and then just touch it again. And I see this in the clinic every time, and the pain just is, even if it's just a notch, but that's enough to say everything. And once we realize the strength of my mind, then we start working just to get it on that to be the path of healing.
Well, I was just thinking about taking a leap, for example. You've got to jump over a puddle or whatever. And you've got to say to yourself, well, I can do it, before you actually do it. Because if you say, I can't do it, you won't do it. You'll fall in. So it's right. And I often use that story about like the two parents watching the children climb the tree, the children climbing a tree. And one parent says, be careful or you'll fall. And the child falls. And the other parent says, hang on tight, it's very windy, you'll be safe. And that kid can stay up. I mean, right.
It's the same simple. Regarding, if you talked about kids, every parent knows that if they react strongly to a kid falling off their bike, then it's going to be a
drama.
It's going to be a drama. The child's going to scream and yell. But if they just, hey, wow, great, you fell, just let's go on
That's
the
right.
day, or even disregard it, then the pain is gone.
Yeah.
Yeah.
And they can stay on. They
That
can hold their
exact
balance.
interaction is happening as an adult. In fact, I always thought this research paper that came out about pain reprocessing, that they tested it against placebo, which is like, oh, that's really getting to the bottom of what the power of the brain.
Right.
We,
It
we,
was an open label placebo.
oh,
It was an open label placebo, but still, the study that they did was. Should I talk about the study a little bit?
please, in,
Of course.
in people terms, not doctor terms.
Right, right. So it was published in JAMA Psychiatry in September, I think, and which is a very nice, like a very renowned a journal, and they did they tested 150 people approximately in three arms. One arm was using the PRT method. The second arm was using an open label placebo of injection of normal saline, which is just normal
Salt water.
fluid, right, without any medication, to the back. These were patients with back pain with a median year of about 10 years suffering from back pain.
Wow.
And so the second arm was an open label placebo, meaning the person knew that he's been getting an injection of saline. They didn't tell him, this is a miraculous intervention,
Anti-inflammatory.
right? Because of ethical, I think, problems, they had to do it in open label placebo. And then the third arm was just normal, regular therapy or interventions, just
Yeah.
right.
Usual treatment.
Right, and the
Yeah.
the PRT was done in 2 months, like eight. There was eight meetings. It was a 1 month, 8 meetings total, and after these 8 meetings, they saw reduction in pain. I mean, zero pain in 66% of patients, and a reduction in pain in around 90 something patients, and 90% of patients. And these were accurate also a year in follow up, like after a year of follow up. And they also did, in the same study, they studied the changes with an fMRI on the changes in the amygdala and the changes of the pain networks with Tom Rager, which is a number one, neuro radiologist studying the fMRI. So it was a very, very well written and well done paper with astonishing results.
Wow. Can you do a minute of just what, Dr. Schreibner, one of his notes, I brought it up in our session with him. I think I brought it up, maybe not. Yes, I did. How this woman spoke to her brain. And, she even journaled and she spoke literally like, oh, hello, brain. So it's another way we can lighten up this sort of like, okay, brain, could you just do a minute for some of the people listening? Of the words that you would say about calming and not repressing your feelings, but accepting and calming, and that you feel safe. Could you just do a moment, like little conversation with, but you
Yes,
PRT?
sure. Yeah, sure. I mean, it's very important to have the neuroeducation first, meaning, when a person talks to himself or talks to the brain, I think it's important to have the correct knowledge and mindset coming with it. So if the mindset is, oh my gosh, I'm dying, I have a tumor in my brain, I don't know what's going on, my migraine is going on forever, I'm probably going to die tomorrow, it's very, very difficult to take that and turn it into something very positive without the knowledge coming back behind that. So first of all, I want to say that, a person, if we take a migraine for an example, has to go through, regular medical checkups, and just to find out first and foremost that really we're not talking about an organic finding, that there's no tissue damage, that he went through um, any like MRIs or CAT scan or something like that, just to quiet down that need to know area in the brain. Reassurance, exactly, thank you.
Yeah.
And then talking with the patient about neuroeducation, telling him that the brain is in charge of the pain wherever it comes, right? Even if you burn your arm or you have this chronic migraine, the same areas in the brain are the ones that light up and are the ones that are in charge of this pain. So once you know that, and you know that your pain is real, and right, this is a process of PRT that we can't jump into, talking to the brain without having this base of knowledge and understanding it and believing it to be true. I think one of the main pillars of PRT is believing it to be true, even if it's not 100%. That's what I tell my patient. I say, you don't have to believe it for 100%. You're going to believe it 100% when you're free of pain. Until then, just give me 95%, and that'll be good.
Right. And accept that you have doubts, and that is okay. It's normal. You're human. You have doubts.
Exactly. Right. Right. So what I would say is, look, just take a minute. Just take a minute and, just bring your thoughts to right now and here. And if you want, you can just concentrate on your breath. If you want, you can concentrate on where you're sitting and, how your back is on the chair, or where your feet are next to the floor. Now, what I want you really to do is just look for the area in the body that needs most attention right now. Which area in the body needs attention right now? Is there an area with pain? Is there an area with discomfort? And if you want to just bring your attention there without really wanting to do anything with that, without really wanting to change it, without wanting to relieve it, just be as a curious bystander, right? Just see that area in your body that needs your attention. And you know that you're safe. And you know that there's nothing really wrong with that area in your body, because we went over that. And you're just looking at that area and giving it attention you need without suppressing it. It may go up, the pain may go up, the discomfort may go up, the discomfort may go down, it may move, it may stay the same. All you do is just give it the attention that it needs. And with that attention, you really know that you're safe and you're at your home, and nothing's bad gonna happen right now. All you're doing is observing, and with this observing comes some breath work inwards, and just see what happens to this area of discomfort. You can see it. You can maybe name it. If there's a color that comes up, maybe give it a characterization. What kind of discomfort is it? Is it some numbing or burning or itching? All you're doing is observing it, writing down notes, mentally of course, about this area that needs your attention right now. That's a small
Could I just make an observation?
of course.
As you spoke, your voice was calming, so you actually gave them a mirror of how to be. I don't know if you noticed that yourself, but you gave them a mirror of how safe they were. You reminded them they were safe,
Mm-hmm.
but you actually gave them the mirror so that they could actually see that you weren't anxious about their problem. Yeah. So
I think the first thing about doing this to others is first getting in touch with that center and calmness inside of me. I mean, I don't think if I'm not in the right position, that I really can't forward it.
But anyone listening now, Rachel or Susie, I'm sure that I had a lovely calming feeling. I'm sure you did, Tova, too, as he was speaking. And that calming feeling was about the resonance of your voice and the slowness of your speech gave the patient a space to actually reflect, didn't it? Yeah.
And
Yeah.
it's really not, it's really because we're just taught in our world from day one about pain is fearful. And what you just led us to is that the pain in your body, you may be concerned about it, but it can't hurt you. So that's an interesting education that pain is in the brain. And that's the education that's so important. And Alan Gordon will talk about he'll have you focus. Like, we're not saying get rid of it or push it away. Focus on it in this, focus on it in this safe, accepting way. And then we're back to ISTDP, accepting it, compassion for yourself.
Well, I think I'm a midwife, and I always think of people in labor ward. You know, when they first go into labor, they think the world is ending because these contractions are so terrible. When they come back the second or third time, they say, "Oh yeah, I'm in labor. I'm fine. It's fine. It's going well."
Yeah, my wife's a midwife as well.
Wow.
Oh, really? Well, she knows what I mean then. Yeah.
I wanted, Eshay, if you could answer Susie's question. Susie's in Britain right now.
You suggest that PRT works as symptoms other than pain. Do you agree? Well, any body-mind syndrome, I think that is connected, that has a connection with the fear factor. I mean, even if we're talking about vertigo or tinnitus, I think it's right, tinnitus, right, and those aren't, you know, pain syndromes, but they're very much very
autoimmune. I mean, the body's attacking.
Totalistic. Can I say totalistic? Is that a word? Like they consume
you, right?
They consume you, and then, you know, it's the involvement of fear is so strong there, right? I mean, you're having this crazy vertigo and dizziness. You can't even move. You can't, you know, and everybody's saying everything's okay, and you're suffering from this dizziness, right? So with that comes the fear. So I think the PRD can also, and if we know that this is a body-mind syndrome, right? So I think that PRT can help with that also, of course.
Yeah. There's another component as well that occurred to me as you spoke, and that is that when we reassure patients, we're actually not, there's a feeling within the patient that you're not understanding me. And the way you were speaking before, you're safe, you're safe, you're safe. It wasn't reassuring the patient. It was confirming with the patient that they're safe with you in that moment. I don't know if you saw the difference, but, you know, if you walk in with your clipboard, so to speak, and your notes, and you say, "Oh, well, you're okay," you've got a mind-body syndrome. You know, bye-bye. We'll see you next month. Well, they don't feel safe. They feel rejected, and they feel as though they're dismissed, I suppose is the right word. Whereas when you say you're safe, look at the pain, look at the symptoms, look at the fibromyalgia, focus on where it is, and see that when you focus on it, you are safe. And that is such a change in a way that the doctor speaks.
Yeah, I think it's very, very important to acknowledge the patient. I mean, acknowledging the symptoms, acknowledging the pain and the suffering. It's also very
that they're real. Yeah,
they're real, and also it's very important to acknowledge also the social aspect. I mean, you know, who's there suffering with you? Your husband or your wife is there. You know, they're suffering together, and acknowledging that as well. So you bring in another aspect of making their symptoms and syndromes look real. You know, he really sees me. He sees how I'm not being a good mother to my children, and that my children are, you know, the pain is eating them up as well, having them in secondary trauma, or you know, what it's doing to my sex life, or what it's doing to my occupational you know, life. I'm seeing everything that has to do with this real syndrome, and putting it like that, then you really know that you have a companion you're not walking alone in this path, because the path in healing chronic pain can be very, very difficult. It can be really long
Very
and difficult and exhausting and full of despair. It's very, very difficult.
Yeah,
Hold it
true.
together.
And some people
Yeah.
are alone. And I know that regarding Susie's question, I would like to ask your opinion because in my work, what a cutie.
Sorry. Sorry.
Where'd that blonde
Yeah.
hair come from? Anyway, in our work, I add autoimmune conditions because I feel like all the things that I've learned in my 36 years and working with Rose in these last couple of years and the Israeli TMS, that these tools and insights can be applied to autoimmune disease, to people with trauma that's turned into chronic disease, somatic. I mean, absolutely, because we're talking about the brain and the body, the heart and the soul. We're talking about the path from the head to the heart. We're talking about autoimmune. The body attacks itself. Why is this happening? The chemical reaction from constant fight and flight, the constant feeling of, and the unconscious. Rose told me something about very interesting. How, if we can make the unconscious conscious, healing can happen. And that's covering all this. PRT's in there. So PRT is one way, but it covers it all. That's the way I feel. What do you feel about PRT? Is not just for pain. It's about understanding your brain and the power you have over your health.
It's a good point, because I'm also, very cautious about not putting it as a magic, this way of healing all kinds and sorts of pain. I think there should be some kind of distinguishment in order to really help specific ailments. Not to say that PRT can't help with cancer patients, trauma patients, of course. And Rose talked about the ISTDP before, about helping even in the wards. I'm sure it can have.
PRT is like a meditation. It's a meditation. It's
Right.
a mindfulness.
Right, but we're talking about, we're not talking about a coping mechanism. We're talking about a healing mechanism. So if I want to talk about a coping method, meaning let's decrease the pain, let's help you, be more efficient in life and make you, then that's a coping method. That's what we used to talk about regarding all kinds of pain. This is your migraine. Let's help you live a better life with the migraine.
With the migraine.
And what I'm saying is, you don't have to live your life with a migraine.
That's right.
You can be without pain completely. And to say that in a cancer patient, when there's tissue eating at their pancreas, it's very, very difficult to say that, even though I understand that the power of the mind, we don't know anything about it, actually. We know very little. But to hold that 100%, faith in a person with tissue damage, I think it's I won't be able to hold accountable to say that sentence. I can say, this can help you manage. Maybe it can help you decrease the amount of pain. Fine, great. I'm sure it's great, right? But if we're looking at the healing process and not the coping mechanism, then we have to be true to where it is really neuroplastic pain and where it's not.
Could I mention also that when it comes to other autoimmune cancers or anything else, we don't actually go to the pain itself, because that's a symptom of something else. So we always go to what else is going on for you. What else would you like? What else is troubling you that I can help you with?
Right.
That I can help you with. What else is happening in your life that's troubling you? And then the pain goes down.
It's very interesting.
And if it's cancer pain, it doesn't matter what pain it is. Then you can see, peacefully if that's the trajectory.
Right.
But I went to at St. V's once. I went to there was a group thing for an autoimmune disease, myasthenia gravis. And as I was talking to the patients and, being the nurse, I discovered that all of them had had a recent trauma. All of them had had something happen, car accident, loss of a parent, you know, all of those things. So whatever the symptom is, the body is actually telling us that we're troubled, whichever way it goes. So
I
yeah,
agree. I agree. And,
yeah,
I came to this work looking for some kind, to help more IBD, like infectious bowel disease, Crohn's, ulcerative colitis, and stuff like that, because I realized the connection, the obvious connection, body mind has to do with an autoimmune disease such as that. There's no doubt that everything that comes up, even if it is structural, it is because the mind told the structure to,
yeah.
diverse. Of
Put a warning signal out.
Right,
Yeah,
right. Get that. Bring those receptors up. Bring those receptors down. This is all
Red
activated.
alert, red alert, red alert.
All activated by
yeah.
the brain. There's no doubt. So of course
Mm.
the work has to be done with conscious, with the mind aspect as well.
Absolutely. But when you've got something like a life-threatening illness, as you say, you can't actually morally go to that space and tell the person that it's in their mind, because all you can do is go to the other problems that brought that problem up and
Right.
make them settle.
But there are
Yeah.
people healing from all sorts of autoimmune conditions and all sorts of cancers. And I just like to say that they're not special people. They're people like you and I. I mean, and they all took responsibility, not like take responsibility. They all decided to go on a path and go inside that I can't imagine how difficult it was, but they made a choice. And I
How do you
always
mean?
say healing is probable and possible. And I met people with MS that got out of the bed. I mean, so I have to blow this horn each time and talk about the probability. And Rose will share about. We also have that with that. The people that have autoimmune. I mean, there's a resistance. There's a conflict. All New German medicine is all about the conflict, and we're conflictual people. We're human. Michael Galinsky will say you have that disease called humanness. We're conflictual people. I attract tons of conflict in my life because it's comfortable for me. So it's like, but we have to be aware. And again, the pain reprocessing, the mindfulness, it makes us aware. And when we know ourselves, I believe healing can happen. And when we are not healing, it's not like you're not knowing yourself, but you're stuck and you're moving. Go ahead, Rose, save me here. Like when Rose will say, Rose will be like, we want to see some character change and acceptance of who we are. And the people that healed this cancer, they accepted some big truths, some really naked truths about themselves. And and a lot of them even did imagination. They did imagination therapy. They did law of attraction. I mean, there's many things that got these people to heal. But let's get back to the brain and the mind and the power. Ed Rose.
Well, you're not including the fact that we have to have a connection, because we're mammals and we connect. So those people that heal are usually healed by a connection.
Connection with themselves?
Yes, but another person brings that connection to themselves.
True.
They mirror back.
Mm-hmm.
It's mirrored back to them that they're safe and that they're worthwhile, whatever. And we've had 2.5 years of therapists coming on and coaches, etc., etc. All of those people have had success stories of how they've helped people heal or people have healed, but all of them heal in community. What do you call it?
Yeah.
Right.
community with another person. And that's why I pointed out the way you spoke before about fibromyalgia and that calm voice. And of course, as a midwife, I'm all into attachment theory, as you can imagine. And it's about attachment because in those first 3 or 4 years of life, our story is set up for us.
Yeah.
And then it just continues on, as Michael Galinsky said, with different players, but the person is the main player.
Right. And
so how you spoke just before allowed that part of a frightened person or frightened child, if you want to say that person's a frightened child, to come closer. Yes, maybe there is a person that understands me. And that's the beauty of how you spoke, that sense of understanding. When you see private patients, do you give them sort of like, normally doctors do give about 15 minutes or 10 minutes to their patients? I'd gather that when you're seeing them privately, you must give them longer, half an hour or something, do you?
no, even more, even more. I sit
Yeah.
with the initial meeting is around an hour and a half, and then afterwards it's around 50 minutes each meeting. I just want to piggyback on things that you said that were very, very, very strong and very true. And regarding success stories, I just want to bring a couple of unsuccessful stories that I have, which may enlight which exactly what you said, and why I think as a person bringing this method or speaking this truth, it isn't very important to know when it is helpful and when it is not. And when people come to me and I start the process with them, and then truths start coming up, they have a choice: if to be truth to that truth that came up and to make the change, or not to. And a lot of
Walk
people
away.
walk away, and that is not a simple task. It's not something simple to ask for them. And some people are so traumatized or have a background that is so difficult for them, that meeting it and treating themselves is more difficult than living with the pain. And they
Exactly.
choose consciously the
To
pain,
walk away.
the physical pain, rather than the emotional pain. And so, just regarding, not everybody, we're so diverse and humanistic, and having to say that everybody can touch into this healing method, so called, which is, it's not a method, but it's more just getting in tune with
Connection. It's a
right,
connection.
right. um it's very difficult, and it
But it's
needs,
possible. It's possible
of
if
course.
somebody.
Well, actually, Tova, it's not necessarily possible because some people can't face care for them. And that's why attachment theory is so important, because attachment will tell us that this person doesn't trust themselves. They don't trust themselves that they can be healed.
But if they
And
know that, then it's a breakthrough.
yeah,
I
but
think, I
they
think in
still walk
theory,
away.
I think in theory everybody can, but I think in the clinic itself, in front of the person, sometimes taking the leap is too much to ask for.
Yeah.
And we have to understand that as well, and take that as, this might not be right for you, and you need this morphine.
Yeah.
And sometimes, just letting the patient be pain free, even if it is, masking the symptom. Sometimes it is the way,
Of
and
course.
and what he needs, and we can't disregard that. I think,
Mm.
not disregard, medicine, or disregard, the applications of medicine, and not disregard people that
Mm.
have a much more difficult time connecting to their emotional selves, to themselves. Um,
No, it's true.
Eshay, there's another component in that, and that is that opioids, which become an easier way of dealing with pain. Do you know what I mean? It's hard for a patient to actually want to go in rather than get the doctor to give them a script.
Yeah.
Mm-hmm.
And you'd find that, I'm sure.
And there's absolutely, I mean, integrative medicine, functional medicine is, please, even I say as a chiropractor, go home, take the Advil. It will work better that you got an adjustment, and it will work better that we talked about, your past. It will work better, the Advil, because medicine, you're adding to the Advil. So I think back to the integrative method and back to each person has a choice. I think healing is, more people are coming out and saying, I'm done with the conventional, or how we integrate. And that's what the PBDA Association is so wonderful about, is that, but they'll say something about arthritis. And I had this discussion with David Hanscom, and, they'll say, well, arthritis isn't one of them. But if somebody has an autoimmune disease, they can benefit from PRT. That's just my point. And I just don't want to say, I think what I'm saying here is that, and you're a medical doctor and I'm not a medical doctor, and, but Rose is a nurse, she has a medical background. I feel that hope and belief. My first book I ever read was, Anatomy of an Illness by Norman Cousins, and The Biology of Hope, and, and Bernie Siegel's, Love, Medicine, and Miracles. And, my trauma is watching my mother, die a vegetable from MS. So there's this trauma of like, well, I'm going to continue healing people until 105 years old. I'm going to be healing, and I'm healing myself. So the point I'm making is that after these last 2.5 years on the Hebrew show, which, Rose has been privy to, but we have 160 or 70 broadcasts of people healing from things and their story. And they meditated, they journaled, they did law of attraction, they did PRT, they journal speak, they did all of this, and and the healing journey continues. It's no cure, God cures. So I think my point in this is that PRT is an incredible way to learn about your brain, to trust yourself, to know that this brain, this piece of flesh we call the brain, is not in control of us. And when we're back to the ISTDP with the feelings and compassion for our human body and our past, our present, and our future. That's kind of like my little, speech today.
Great. Hey, Tova, I just want to regard what Susie says, that sometimes the healer is the wrong person for the sufferer. And that is so true.
Yeah.
That sometimes really to know when you're not right for this person.
Absolutely.
And to step back and step down, it is so important. And all of us, I think, that are in this profession have to work on that egoless. I always remind myself when a new patient comes in, all I really want is them to get better, and I don't really care how. I don't need it to be me. Right. And it's so important. Thank you, Susie, for that comment, because sometimes when we get too much involved and we say, okay, no, it's not right for you. I'm okay, but it's not right for you. Just look at that a little bit closer and see, maybe I'm not right for you. And maybe you need a feminine touch, or you need somebody else to talk to you in a different way, and don't give up, and, go get some help.
And what's beautiful about you, Eshay, I'm going to interrupt like a good Israeli, is that a couple of the shows, people went to their medical doctor and said, I need you to be on board with me. I need your help. I need support. And they found a medical doctor that literally participated, so much in the healing because of that connection, that community, that hope and belief. That's right. So absolutely. And when patients know themselves and know that maybe I think it's back to knowing yourself and knowing, I tell everyone I speak to, I said, talk to this person. You have to decide where you feel the safest. Who do you feel the safest? Because this is about safety and threat.
Right.
So we're back to, it's just beautiful that we're talking about this. We met a wonderful psychiatrist who's teaching ISTDP and I think in Canada, and he talked so much about the relationship between the doctor and the patient, and it was so sacred. It's a place that someone can really heal or not, and then for someone to know whether they should move on. And it's a very, very good point. Very.
Could I add to that
You may.
also? Patients that find it that the therapist is frightening or they're not quite right or whatever, it could be the case, but also to see if that's sort of like a fear in them of trusting other people.
Also.
Yeah.
Good,
Because
very,
it's
very
the
good.
fear in a person that there's no one safe in the world.
It's going back to the attachment.
Yeah.
And how much is doctor our God? I mean, we all grew up. I grew up like that. The doctor is God. The doctor's meant to heal, and we give the power away. So again, we're back to knowing yourself and loving yourself, and
My mother was a nurse, so the doctor wasn't God.
True, good for you. And I always say this over and over again. The word for nurse in Hebrew is the same word for sister, which is profound. Profound. So you have a wonderful combination of great skills, Eshay. First of all, being a wonderful father to 5 people and a husband to a wonderful wife who's a doula. I mean, you're in an amazing position to know yourself through this work and to help so many people be on their healing journey. In the emergency room, I mean, that special person comes to you and they're freaking out. Emergency room freaking out. And you're right there with that calming, rooted, like, breathe.
That voice of yours, so calming.
Thank you for the kind words.
It's true.
Yeah, and the Dalai Lama says if you want to be happy, what does he say? If you want to be happy, he says if you want to. Something about making somebody you have to express. I forget what he said. It was Dalai Lama was always saying profound things. Anyway, I forget what he said. I can't be profound this minute, so you be profound, Eshay, now.
I think we're all on this journey to heal ourselves, and it doesn't. I know Tova, you talk about it all the time. That in this journey, you're healing yourself. You're also helping other people, but the real healing is really how we feel. And if we really get in tune to our feelings and our needs to heal ourselves through this work, then, as you said before, Rose, mirroring. I mean, this is what we mirror. If we heal ourselves, then that's what we do. And
Well, in core training, the first lecture was, you've got to give a patient a complete space in your space so that you don't counter-transfer your story onto them. Would you, Tova, please bring up Susie's comment? Pain has become the main focus for this work. Could you?
Well, yeah. I think Susie usually brings up that we focus on pain, but she doesn't have as much pain. So she wants to be assured and rest assured that this work, it doesn't matter if it's pain. Remember, pain is an emotion.
It's chronic fatigue, right? It's chronic fatigue. It's vertigo. It's dizziness. It's tinnitus. It's anxiety. It's depression. All these ailments are their thoughts. As Schubiner said, it's a thought. It's hard to take in that a person in so much pain is just a thought. But when you go down deep into it, anxiety, the work is the same regarding anxiety, depression.
Yeah.
And I thoughts, there's people that say you can't control your thoughts, but you can control your response to your thoughts. And I have seen if we can accept our thoughts and understand our thoughts, then we can change how our unconscious is bringing them up. Can you chat about that a bit regarding that in the brain, the unconscious? How about the unconscious and the conscious? Can you chat about that regarding your work for a moment?
I think it's difficult regarding the unconscious. I think that we're trying to touch the unconscious through conscious work,
Right.
right? But to get to know what is a thought, and what is a response. It's also something we have to learn how to do. Responses are mostly automatic, and to make that into something spaced by, this is Buddhism, this is Vipassana. A thought comes in. How do you react to that thought? First, you have to know what a thought is, and second, you have to know what your reaction to it. And it could be very, very. The nuances can be very, very thin, and it does need some training, right? To go and dwell into that, and then work, and then know how to work with it. I mean, first realizing that it exists. I mean, why do I yell at my children? It's an automatic response. Do I yell at them because they hurt my feelings? Do I yell at them because I don't have any much time, or do I yell at them because that's the only way I can express? I mean, this is so nuanced and so deep, but in a couple of minutes it's difficult, right? I mean, just to be aware of your response to your thought, it can take, it's a lifetime.
I'd love to bring you back and talk about Buddha and thoughts, because thoughts are just energy, which is a whole nother TMS roundtable year. I mean, we're talking about energy, and that's a whole nother, it's another scientific research. What do you say about that?
Thoughts. Well, I come from the Chinese medicine, which I thought would talking about energy and qi and meridians. So I think everything is, the knowledge is so wide, and the terminology is maybe different, but we're all talking the same. We're all talking about the same things. You can.
Yes, absolutely.
Yeah, wonderful.
We're all talking about the same things, but it depends on what, Susie said, one person, hypnotherapy will be good for one person, and ISTDP for another, and PRT for another. But it's about that connection. It's that human connection. And if you get that, you're on the path.
I agree.
Yeah.
So Eshay, if you were to leave our listeners, because this is going to be on our YouTube, and we're almost reaching 1,000 viewers, 1,000 people that subscribe to our YouTube, Rose. So it's really wonderful to be reaching people.
Two grandmothers, hey?
Yeah, two softas, two grandmothers. But what would you like to say to the audience, to the listeners, about healing and healing yourself and the ability? And would you like to share about that?
I think to really go on this healing journey needs a lot of courage, and it needs stamina.
Oh no, we lost him.
He'll come back. And that word,
dear. And what words of wisdom.
Endurance,
courage and stamina,
and patience.
Yes,
yeah. He'll come back in a minute.
And patience with yourself.
Yeah. Endurance. Endurance is like, can I be with this pain? Can I feel safe again today with this pain? The endurance, ability,
but it's also endurance to actually investigate it. Endurance to keep on observing how I'm reacting to things rather than responding.
Absolutely.
And that Michael Brown book, Reaction Rather Than Responding, is so true.
Pick up where
you have these amazing
stamina,
insights.
I don't know what happened, but
stamina, and we didn't lose a second.
So what I just wanted to say is I have this kind of bad feeling that, all around the internet and podcasts and whatever, there's always these great stories about healing and healers and people doing their journey, and it seems like an easy fix. And what I want to really put out there is that really it takes stamina and it takes courage, and it takes patience, and it takes help, and it's hard to do it alone. And really, I just want to say this, we've seen miracles, and Tova and Rose, we talked about it a lot during this show.
I don't want to call them miracles, but I won't interrupt. Go ahead. Yeah.
We've seen people that I think what we don't see underneath is how hard it was for them. And don't forget that you're walking the path, and it may be difficult, and nobody's gonna say that this is an easy fix or easy, and it needs, just keep on going. Just keep on going. Don't give up. And that's really what I want to say, and that's what I say to my patients as well. Just keep on walking one step at a time.
Yeah. Tova, could you write this in on the thingo? The book is called The Pilgrim's Journey.
The Pilgrim's Journey?
Yeah, by Paola Coleco, I think. I'm not quite sure how you say it. But the pilgrim, he's in Spain and he's got a problem. I can't remember. It's so long since I've read it. He goes to Morocco. He goes to Algeria. He goes to Egypt, and he's looking at the map. And then he realizes that the map tells him to go back to Spain. And it's like, you go externally to all the doctors. In the end, you find that you've got to come back to yourself and to your own heart. But it's just a lovely book if anyone wants to watch it read it. Yeah.
Wonderful. So
Right.
wonderful. Thank you so much in the middle of your day, and I'm happy that you felt comfortable. Usually Rose's grandchildren will walk in, because your son walked in, and because it's, we like to make it very sababa, very comfortable in our studio, and it's very real. And we'd love to have you back and talk about Buddhism. We had some wonderful people talking because it's beautiful. Nothing new's under the sun, whether it's Torah, whether it's Jesus, whether it's, Allah, whether it's Moses. We're talking about repetitive intelligence. We're just talking about it today in the framework of this, but it's amazing, and we're all learning. And I appreciate that you brought that up, because we really, we learn so much from our clients, so much.
Mm-hmm.
And privileged to be side by side with you, Eshay, also here. And so we'll bring you on again, and maybe there'll be an Eshay Friedman show sometime, and you'll interview us, because Rose is quite interesting. You know about me. Anyway, so have a wonderful day. Rose, have a wonderful evening, and we'll be back next week. God bless.
Yes.
Thank you.
Bye.
1 second.